Well, in 2015, intravenous drug use in Scott and Clark County spurred the largest HIV outbreak in Indiana history. Vice President Mike Pence was governor then, and the situation attracted national media attention. Since then, medical officials have gotten the situation under control, but drug use has been a continuing issue. And as Mitch Legan reports, drug use skyrocketed when the pandemic hit and the state locked down.
For 4 years, Lisa's been attending recovery meetings at St. Paul's Episcopal Church in Jeffersonville. She'd hop in her car once a week and make the 30-minute drive to get there early, open up, and make coffee. But that all stopped in March after Governor Eric Holcomb issued a stay-at-home order, locking the state down to slow the spread of the coronavirus.
I was due to celebrate my 9 years. That Friday they called and said that everything was being shut down. And I was due to celebrate on Monday. And it really hit me hard. And I haven't been here since.
It's been a lot of work, but Lisa stayed sober through the pandemic. But for many others in the area, that hasn't been the case.
We're down about 40%, as far as overdose deaths and ER visits for overdose. And then once COVID hit, you saw that trend right back up again.
Overdose numbers in Clark County began skyrocketing when the governor locked down the state. By the end of April, overdose deaths were up 150% compared to last year.
January, February, March essentially mirrors 2019, and then all of a sudden you see it shoot up and stay up for 6 months or so now.
May saw the most overdoses since the county started keeping track of the data roughly a decade ago. And with about 2 months still left in 2020, the number of overdoses in Clark County has already surpassed last year's total.
If it was me and I was still in active addiction, and that was what I needed to make me okay, the pandemic would be an excellent justification for that. It would be an excellent reason. And so I'm not surprised, because that's kind of the way our minds work.
Counties across the state have reported overdose increases too. Indiana drug czar Doug Hunsinger says before the pandemic, Indiana was a success story. The state was seeing overdose deaths decrease by twice the national average.
We've seen a 79% increase in our opioid or overdose events at emergency departments. We've also seen a 63% increase in EMS naloxone administrations.
Lisa says many recovery groups, including her own, moved their meetings online at the start of the pandemic, and other options, including treatment centers, have been open.
Kind of made me more reliant on my friends and on my sponsor. I was always very reliant anyway on my sponsor, but very much more reliant. And just knowing that they're there, knowing that they're still clean.
Yezel will tell you that not having those personal connections and stability that come from group meetings, employment, and just regular life likely exacerbated feelings of isolation and hopelessness that were already on the rise because of COVID.
It's absolutely, an unintended consequence. And that's one thing I say is some of these public health decisions we make, we can't do them in a vacuum, because, my philosophy, at least, locally here, has been to kind of stay in the middle. If you're too aggressive, you're probably putting people at unnecessary risk. But if you're too conservative, the things you're trying to protect, some of that fallout outweighs what you're trying to protect in the first place.
The good news is that Clark's overdose numbers are beginning to level off a bit, and many groups have gotten back to holding smaller in-person meetings.
The big silver lining I take is the fact that even though our overdose activity has increased, our death rate has not increased as much, and so that tells us that some of our programs are effective.
One of those programs that stayed open was the county syringe exchange program. That's especially important because in 2015, neighboring Scott County was the epicenter of an HIV outbreak. Clark was also affected, and if drug use has gone up,
it does lead to concerns that you'll have, increased HIV or other IV drug use related infections and things like that are going to start popping up in, like you said, the next 6 to 12 months.
Clark County's Board of Commissioners voted to extend the county syringe exchange program in August. It's set to expire in July of 2022, the same time as the state's law that allows the programs to operate. Yezel says the exchange program is critical to keeping potential HIV cases down and hopes that when it's all said and done, this will be another example for state officials to see the effectiveness of syringe service programs.
COVID-19's effects on the opioid epidemic, substance use disorder, it just shows how fragile this environment is. And anything that kind of shakes the societal norms that we have, and you go right back to to the 2016 numbers, and that's what we saw.
As for meetings at St. Paul's, Lisa says she's not sure when and if they'll start back up again.
I'll find out where the meetings are, if there are any going on, and I'll wear my mask and do what I got to do, because I don't want to have to live in that hell again.
For Indiana Newsdesk, I'm Mitch Legan.